Community Health Worker presentation by Michelle Hardman, Community Health Worker out of the Clinton County Branch Office. What you don't know about community health workers. Mid-Michigan District Health Department has 3 community health workers, and each of them are based in their branch offices. Community health workers are resource specialists. They know the community resources for the areas that they work in. They assist clients in getting the services that they need because they know what is already available in the community. We can be advocates for the vulnerable. We oftentimes represent individuals when applying for entitlement programs, and we can be a voice for the voiceless. Agency partnerships. Through many collaborations, communities become stronger because we partner with other agencies to help identify and meet the needs of the individuals that we work with. Community health workers are MyBridges Navigator trained, meaning that we can assist people either online or by paper applications to apply for all the benefit programs that the state of Michigan offers through the MyBridges program. As a community health worker, we also sit on many of the specialty health court teams. As being part of the team, we can make referrals to the Pathways program, which help us to identify the needs of the individual on the program. Through the services that we offer, these individuals can graduate their program successfully, and the hope is that they can avoid criminal behavior in the future. Community health workers make their communities healthier. Part of this is by helping clients find a doctor and a medical home. This may be achieved by helping locate doctor offices that are accepting new patients, by obtaining the new client or new patient paperwork, helping a person fill it out, and even returning it if necessary. Oftentimes, when community health workers are in the home, we may also identify when more than one prescriber is issuing the same medication. Oftentimes, the medication assessment chart is completed and sent to the doctor for them to identify whether or not there are duplicate medications being taken. Medical resources are another area that a community health worker can help our clients with. This may be helping finding an agency that has pill boxes, walkers, wheelchairs, or incontinence supplies. Community health workers assist clients in getting Medicaid. Oftentimes, individuals that we work with have no health insurance and they have many chronic health needs. A community health worker can assist a client in an online or a paper application for Medicaid. Oftentimes, because the Medicaid process is confusing and has multiple steps, community health workers can assist the clients by helping them meet their deadlines by collecting and uploading proofs that are needed by the caseworkers at the state and helping them to enroll in the Healthy Michigan plan after Medicaid has been established. Community health workers also provide education materials on chronic health needs. We may give an individual a diabetic log if they're not properly maintaining their diabetes. We also provide government resources which are tailored to their specific chronic health need. We also can help them comprehend the materials that we provide them or assist them in recognizing their need for change so they can be healthier for tomorrow. Community health workers partner with Medicaid health plans so there can be better health outcomes. Many times direct referrals can come from the health plans regarding high ER usage or high-risk participants that need more support to engage in healthier lifestyles, or perhaps they need a referral to another program so they can avoid readmission or relapse. Community health workers often work with the homeless. Referrals to local housing authorities are often necessary when working with homeless clientele. In addition to the homeless, we often assist clients in obtaining low-income housing. This can be achieved by getting applications, assisting the individual in completing and submitting these applications. We also partner with other agencies to help get the financial assistance, not only for the application submission, but possibly for move-in expenses. This may be a referral to a local church or an other rent community program so that they can get not only rent assistance, but potentially the deposit assistance needed for move-in. We partner with other agencies so individuals can receive furniture and household supplies. It's not just, yay, you're no longer homeless, but now that we've found you an apartment, maybe we can get you a bed or some other furniture. Oftentimes, this is achieved by making referrals to agencies that can help people by obtaining new beds or furniture. Community health workers provide connections for healthier communities. Food pantry referrals are given. These could be local lists that have the addresses and also the requirement that an individual needs to obtain the assistance. Clothing referrals are also made. Not only just a list of agencies and their addresses, but what are the protocols that somebody might need to get help? The what, who, when, and what is required are often the information that we're able to provide to the individuals that we work with. Entitlement program assistance. These are all the programs that a person qualifies for due to their income or their circumstance. This would be the MDHHS benefits, including food, Medicaid, childcare, utility assistance, rent assistance. This would also include government phone programs. We oftentimes assist individuals with new patient paperwork. We can obtain it from the doctor's offices by downloading, printing. We can help people complete that, and we can even help them return it if need be. Housing assistance is something we regularly assist people with. We can obtain housing applications by downloading and printing the applications for people. We can also help people complete them, ask other agencies for assistance, and make referrals to necessary programs that would be able to help them. These could be Section 8 or the Veterans HUD-VASH Assistance Program. It may be DHS for rent assistance, or possibly if they're facing an eviction, it could be DHS for eviction assistance. We oftentimes help individuals when they have legal needs. This might be due to financial exploitation, physical abuse, domestic violence. It could be Social Security disability. It could be a free legal program for elderly or the low income. We often help people with transportation. This could be the guidance on what Medicaid allows for transportation, how to get access to it, possibly even helping somebody establish transportation for the first time. It may also be enrollment into a transportation program within that community or guidance on how to achieve transportation to certain services. Community health workers strive to keep people safe in their homes. This may be a referral to Meals on Wheels if somebody qualifies. It may also be a referral to the Medicaid waiver program. It may be a referral to visiting paramedic program, or possibly even a visiting nurse or visiting physician if appropriate. Oftentimes, we do make referrals to adult protective services, and we give referrals to mental health services if it seems appropriate. Now that you've seen a little bit about what I do every day, how about hearing about how this program changes lives? I had on my client load a 56-year-old male veteran. He had a current court date for a property tax eviction. He was being foreclosed on. He needed health insurance. He had no doctor and found it impossible to get to the VA due to transportation issues. He was in need of medication for chronic health. He also needed mental health counseling. He had no food and he had no income. When I met this individual, he was pretty desperate. Through my intervention, I was able to help him with a Medicaid application. We also helped him enroll in one of the Healthy Michigan health plans. Due to the issue with the VA, we were able to get him established with one of the local doctor's offices. This was easier for him because he could also use local transportation to get to his medical appointments. The doctor started prescribing him all of his medications so he could address his chronic health needs. The client had identified himself as being depressed, so he was referred to a mental health agency that began giving him counseling sessions in which he started receiving them monthly. There was emergency food resources that were provided for him at the initial visit. I assisted him with doing a food assistance application through MDHHS so that he could get a bridge card for ongoing food. He had no income, but he was a veteran. I assisted the client in a veteran application and getting connected to a veteran special services worker. We found out that this client was entitled to a VA pension that he knew nothing about. He also received a VA disability for a disability that was reported during his service time. Not only now did he get monthly income, but he also got back pay for it. Even though I was not able to help this client with his eviction, I was able to assist him in getting an apartment. He was able to qualify for the HUD-VASH voucher program, which helped him with the security deposit and the first month's rent. Another success story from my current caseload. I currently have a married couple on my caseload. They're homeless and they're living in a tent. They have no means of communication. They have no health insurance, no doctor. The wife is diabetic. They had no food and they were not employed. I was able to assist this family in connecting with Medicaid by doing an online application through the MyBridges system. They were approved for Medicaid with the assistance of me as their authorized rep, being able to complete their interview process and upload the needed documents to the MyBridges system for their approval. They picked out a Healthy Michigan health plan, and they established with a local doctor. The doctor prescribed the needed diabetic supplies, which was a meter, testing supplies, and medication. Because the clients had emergency needs for food, we were able to connect to some food pantries, which gave them emergency services. I also did an online application through the MyBridges system for food benefits that would continue. The clients needed employment, and there was a referral that was made to Michigan Works. Through the Clayton County office, they were given some bus passes so they could get themselves back and forth to the Michigan Works program. Because they were homeless, there was a referral made to the local housing authority for assistance. I assisted the clients in getting apartment applications and submitting them for them. I contacted local churches to see if any of them would be willing to pay for the application fee, and we did get successful financial donations. I assisted the clients in applying for a state of emergency relief application through the MDHHS Bridges system for the security deposit that would be needed for a new apartment. These clients were approved for housing assistance through one of the local housing authorities, which gave them ongoing rent assistance. The MyBridges system approved them for their security deposit, and I'm happy to say that this family moved into their apartment on July 7, 2019. We were able to connect to some local agencies that provided them with a new bed, and we're still working on furniture. This client has also found part-time work and is still continuing to look for full-time employment. It seems pretty simple to say that a community health worker makes referrals. The purpose of the Pathways program is to initiate change to make healthier communities. I am privileged to be part of a program that changes lives every day.